very common for many different reasons, is vomiting and diarrhea. Vomiting and diarrhea are very non-specific symptoms of many, many types of diseases, just like as in people. It could be something as minor as nervousness, or it could be something as severe as a toxin ingestion or something like that. So what we will typically do as a first line of treatment is I have my pets just remove the food and water. Dogs and cats, if they're vomiting, and especially dogs, they get dehydrated, and they know that they need to drink water to keep hydrated, so they start this vicious cycle. They'll vomit, they'll walk to the water bowl, and they'll drink. Then they'll go vomit. Then they'll go back to the water bowl to drink some more. And, pretty commonly, if I have a patient that comes into me and the owner said that the dog has vomited 10 times in 2 hours, almost every single time those patients have been drinking water and then vomiting, drinking water and then vomiting. So what we do is just pull up the food and water. If there's no vomiting for 8 to 12 hours, you can slowly reintroduce water and then again reintroduce food after that. The other thing is if we have diarrhea or vomiting, sometimes we'll feed a bland diet. Bland diet meaning very easy to digest. So we want low fat and carbohydrates. So we typically will do something like lean ground beef or ground turkey or chicken breast mixed with some type of carbohydrate source like rice or plain pasta or cooked potato, those types of things. That's not a balanced diet by any means. It's far from balanced, but it's good on just a couple of days or something like that. What we're trying to do is trying to give the pet something easy to digest. Cats, unfortunately, don't do the bland diet thing very well. And cats they may vomit intermittently, but oftentimes they have primary intestinal disease, or they've got fur balls or something like that they're vomiting. For cats, what I typically do is I will just remove the food. I don't remove the water in cats. Cats aren't big water drinkers to begin with. So if you leave the water out, they'll typically regulate themselves on the water, unlike dogs. But I do pull up their food for about 12 hours, then slowly reintroduce small amounts of food. In cats, one of the big things I do is remove like the pounce treats and things like that are a little bit more rich, just to try to remove anything that might instigate vomiting for them.
When dogs eat grass, is that a sign of a digestive problem?
It's $1 million question. I wish I could write a book on why do dogs eat grass, because it would be a bestseller, I'd be a millionaire, and it'd be great. But I wouldn't have no answers, because nobody knows. I mean, we know that dogs are omnivores. They're both meat eaters and they're vegetable eaters, and so it's not abnormal. My dogs are grazers. I know my normal behavior of my dogs. They go out, and if there's some nice fescue out there, they're going to graze it. That's normal for them. Other dogs, I do believe, do it to induce vomiting when they're nauseous. So I think probably the important thing to do is know the routine behaviors of your dog. If my dog went out to eat grass, it's normal. I don't think that it's a problem. But if your dog goes out and they don't eat grass, it's not a big, and then they just sit there, mow down grass, and then they go and vomit it, well, that's probably do it because they're upset or they have an upset stomach. So it can be normal, but it also can be abnormal. That's a great answer to your question, right? Yes?
I've been told that pumpkin is good for diarrhea.
You can use pumpkin. It's a higher fiber source. And so we'll typically use that in dogs that have chronic, like soft stools over time. You can add that pumpkin to help absorb some of the liquid. You can also use just small amounts of Metamucil. That's more, I typically will use pumpkin more for chronic diarrheas. Pumpkin is actually a fairly good point of debate amongst nutritionists and internists. Probably half of the internists hate pumpkin. For some reason. I think it works well in some pets to help with them. I don't use it with acute diarrhea. It's a diarrhea that just starts immediately. I don't use pumpkin in that situation because that's another thing that they're not used to eating all the time that actually may upset their stomach. Do you have a question?
Yes.
Yes.
Back to toxins.
Yes.
Do you recommend activated charcoal at all, or under what circumstances?
Well, activated charcoal is given in those cases that we don't think that we've gotten all of the toxin out, or those that recirculate, so they're absorbed from the intestinal tract, go up to the liver, then enter into circulation again and continue to circulate through the system. We'll use activated charcoal in those systems or in those scenarios. Activated charcoal, though, we will use on a case-by-case basis. Totally depends on what the toxin was that was ingested, and then also what its mechanism of action is. So that's really going to be very variable. If I've got a patient that I'm pretty sure that has ingested a toxin, we vomit, and we're questioning, did we get it all out? Has it been maybe more than 4 hours since they ingested the toxin? Most of those we will use activated charcoal in. It's not contraindicated very often. The only time it's contraindicated is if we have patients that are lethargic, if they're comatose, if they've had seizures or something like that, where we might be concerned they might aspirate that activated charcoal. That's about the only time that it's contraindicated.
What about, as a handler in the field, would there be a time when we would want to do it for emergent care?
If there's a toxin that has been ingested, you've administered something for to induce vomiting to remove the substance, you could use it. Most of the cases, if they ingested something, do you have a specific scenario, or just if they went and got into a bunch of garbage or something, you have no clue what it was? Or?
I'm a canine handler for search and rescue. We work in a lot of buildings. Okay. Dogs are exposed to a lot of stuff.
Yeah, if it's something that is a toxin of sort that you're concerned that they ate, then it wouldn't be wrong to do activated charcoal. Yeah, it's rarely, I'm trying to even think of a contraindication to it other than if they were seizing or if they were comatose. I think you'd be fine doing it.
But we want them to vomit first?
Yeah, absolutely. The bulk of getting that, it's kind of like a wound. The big thing is you want to remove all the big particles, and then you can treat the small particles. Same thing with a toxin ingestion. We want to remove as much as we can out of the stomach. Give them the activated charcoal to help coat the stomach and to bind to substances so they don't get reabsorbed. And it typically is best if you give it within the first 4 to 6 hours.